My name's Professor Karen Rodham. I'm a health psychologist and my research focuses on how people cope with complex and long-lasting physical conditions. When I was a practitioner, I used to work with patients with complex regional pain syndrome, CRPS for short, and they were telling me that when they were looking for information, the Wikipedia page was very medical and their voice was missing, and one of the things they would love to have was a wiki page written by them for them. So we set up an online forum for patients to join and get to know one another, and we also wanted to see how support developed. And after about 6 months we asked them to start designing the wiki page, and they didn't engage, and this was really disappointing because they told us this was what they wanted. So we tried a number of different techniques. We emailed them, got some feedback, put that up for them, and still nobody would comment. We ran some focus groups and we tried a variety of ways of getting them to engage, and they wouldn't. And we think it's because in Facebook and social media you post something and it very quickly disappears, whereas a wiki page is fixed and open to scrutiny. So we went back to basics and looked at the discussion forum for the first 6 months, harvested that data, learned what was important to them through the discussions that they'd been having, and then designed a suite of leaflets. We didn't feel there was enough for a full wiki page. We ran these leaflets by this group and ran them by a patient conference, and between us co-created a set of 3 leaflets. We now have a suite of 3 leaflets that are freely available on my website for people with CRPS to use. These leaflets are being signposted by the new CRPS Gold Standard guidelines that are coming out shortly. So that's a really important way of raising awareness about them. But the other important implication is in publishing this paper in the academic journal, we have been able to get out the message that research doesn't always go to plan, but that you can still salvage things and make an important difference when things don't work well.